Mental health is a driver of healthcare cost. What are you going to do to help us with all the depression, anxiety, substance abuse, and domestic violence that our families are also coming in with? We need help. This is a huge burden. In the very beginning, we set up a pilot at this clinic and said, can we redesign the process from which a patient walks in the door and walks out the door to kind of incorporate and normalize mental health as a routine part of medical care. So what mental health integration actually became is an infrastructure for all chronic disease. So if the patient came in with diabetes or asthma or depression or hypertension or substance use, they were all considered concerns that had to be managed kind of with a routine, really clear processes. I think in the very beginning, the other novel approach was to really use everybody that was at the clinic, including patients and families, to sit around a table and say, how do we want this to be different? When a mental health issue comes up in any concern, whether it's a sore throat or you're actually there to talk about depression, how do we want that handled? What are the tools that we need? What are the cultural changes we need to make? And everybody had a say in it. So that part was, I think, pretty novel as well in the beginning. We built something for all patients that were coming to the clinic to see their primary care doctor. So regardless of their ability to pay, if whatever visit you walked in for, you had access to this new team process. The biggest change is that health outcomes actually improved. So whether you were there for your diabetes, working on that with your team, or whether you were there for depression or other conditions, patients' health actually improved. By doing mental health integration and having it be something that is a routine part of care, we've been able to provide more prevention and safety related to mental health issues, as well as treating specific mental health conditions like depression and anxiety and bipolar, and getting them under control and getting people care.